It can be the most frantic and critical moment of a person's life. That ambulance ride to the ER is intense, but patients in Tarrant County will soon have one less thing to worry them. Bradley Blackburn takes us inside a partnership that's saving time and improving care.
I don't have a pulse.
The patient on the table doesn't have a heart.
Start chest compressions.
He's made of rubber.
All right, let's get him on the monitor.
But Dr. Torlbakta and her team are doing life-saving work.
All right, let's do 1 milligram of epinephrine.
They're practicing with drills.
All clear?
Before they open a brand new emergency room at Baylor Scott and White Fort Worth next week.
We want to be totally ready on day one when we open.
4 hours of training every day to learn their new workplace and make changes. After this drill, they'll move a crash cart closer.
I think this was a great learning opportunity for us because we can move our equipment.
The new ER is all about changes, small ones like private patient rooms in the waiting area, power outlets at every seat, and big ones.
This is our beautiful heated helipad.
They've made it faster and easier to get patients in the door when seconds count, working together with ambulance service MedStar.
To the extent that Baylor reached out to the EMS community and specifically to MedStar has never happened before.
MedStar brings 600 patients to the hospital every month, so Baylor brought them in to design the new ER.
Literally, they came to us from the very beginning when everything was just a blank white piece of paper and talked to our crews and talked to our field staff.
Us as an emergency department could not function without partnership from MedStar.
At other hospitals, it can take 3.5 minutes for an ambulance to get a patient from the street into the emergency room. This is designed for speed.
We're able to cut that time down to about a minute because of the way that the parking is done, the way that the ambulance flow is, and in crucial situations, that could be life-saving.
It's also the first hospital in Tarrant County to have power hookups. Ambulances won't need to idle their engines and release exhaust, a direct result of the collaboration.
We were able to tell them about this, so it was built into the plans when they were building the facility.
This new wing adds 10 extra rooms. It'll help them see more patients, and that's important because Tarrant County is growing so quickly. Over the next 5 years, they anticipate a 10% population growth.
The EMS has just brought in
a rare chance to start from the ground up and make an emergency room better.
Let's check for a pulse.
And they'll use every second to get it right before these doors open. In Fort Worth, Bradley Blackburn, Channel 8 News.